Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OB-GYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome, Sky community. Welcome back to another episode of Sky Women. Today, we are shaking it up a bit and we are talking about menopause from the patient's perspective. And I have with me today AIM, who is a healthcare administrator, a self-proclaimed computer geek, and in the throes of menopause. And I think it's going to be really interesting for us to have this conversation about how it impacts women in the workplace. When we're at the height of our career and we're trying to function and we're wondering what in the world has just happened to us and how to find the help that we need. Welcome, AIM.
Hi. Well, thank you so much for having me.
Yeah,
I appreciate it.
Absolutely. So I don't know if I shared your age. You want to give us your age range?
Right. Well, I'm about 52 years old. So I am postmenopausal. And have grown wise to menopause in my journey. And then I would say in the hard way. I learned my lesson the hard way. So, yeah.
And as we chat a lot, you have shared kind of that frustration and that journey and the symptoms that you were having and how you've really become a warrior, looking online and going to different providers and trying to get the help that you need. So walk us through that, maybe starting with when you first had symptoms.
Well, I first started in the perimenopausal. I was in my 40s, and the traditional symptoms started, and they start out as kind of like the little bit of brain fog and a little bit of the hot sweats, the insomnia starts, those type things start, and you think, okay, well, I get this is natural. This is what you're supposed to do, and as I started looking around and listening to, okay, things are changing. The problem I ran into is false information. There's just so much misleading information on the internet and just in healthcare in general, just from one provider to another. So I wasn't getting any information or prepared from my doctors that I were using at the time, from my gyno to my PCP. They weren't like, hey, get ready. This is what's going to happen. Or, that's natural. You just got to get through it. Okay. Well, okay. In perimenopause, diet, exercise, a little bit, right? It seemed okay. And I was able to control my weight and be, I thought, normal. But what I realized now wasn't. That was kind of like setting the stage for what was coming. And what was so frustrating for me was I'm going to my annual visits. I'm going to my different doctors. Nobody's preparing me for what is about to come.
So you were having symptoms and you were having these discussions with your provider and they were just like, yeah, it's expected.
It's normal. It's expected. It's normal. Just get over it. Get a fan.
Did anybody ever mention perimenopause?
No.
Or treatment for perimenopause?
No, never got any of that. And the thing there was nothing even pointing me at anything, a pamphlet, something. Not one provider said, here, go learn this or read this book or here's a pamphlet or this is what's going to happen next. Got none of that.
Okay. And so then as you progressed into menopause, I'm imagining that things kicked up a notch.
They kicked up a notch. That's when what happened was, I kind of just started feeling, I was like, what I'm being told and what I'm feeling are two different things. And I'm in the middle. The thing about it, at that time in your life, when you're in perimenopause and you're in menopause and you're transitioning to that postmenopausal world, first, I didn't even understand those three phases of menopause. Right. There was none of that education in there. What kind of drove me was this. I'm in the height of my career. I am a geek and I am in the white collar world and I am having to function and think and problem solve and think on your feet. Yeah. Walking into a meeting and staying there and all of a sudden you start sweating from head to toe and literally everybody can see your brow outline. Good luck. I'm just like,
all of a sudden nobody is focused on what you're saying.
Yeah, that's
Like a
off
wet
the
t-shirt
table.
contest.
Exactly. And nobody warned you about that.
Mhm.
And the thing is, and they're like, oh, it's normal, it's natural. Really? Do you know how natural it is to have uncontrolled periods, uncontrolled flow
Mhm.
in an office building? Most of them don't even have bathrooms in the suites. You have to get
Mhm.
down the hallway. Good luck find it in the maze.
Mhm.
Especially if you're in a job where maybe you're traveling in sales like me, like I had to go to provider different offices to
Mhm.
do my job. So I never always knew what situation I'm in. But once you get into perimenopause, menopause, you better know where every bathroom is in every
Yeah.
situation. And so no one's preparing me. I just keep hearing that's normal. This is natural.
Mhm.
Okay, well, how am I supposed to function as a human being,
Mhm.
as a career woman? Not only do you have these meetings, and as I progressed and things began to transition out of that, menopausal into postmenopausal, I was
So you're
still
no
being
longer having periods. I just want us to clarify that.
okay.
Perimenopause are all the years around leading up to menopause, which can last for 10 years. So yes, in your late
Uh,
30s, you can even be having symptoms, definitely in your 40s. Menopause is defined as 12 months without a cycle. And then from there on, you're postmenopausal. So your periods finally stop. It doesn't sound like
yep,
you got any management for
no,
your
no,
irregular bleeding through that perimenopausal phase. Okay, so
no.
now you're transitioned into postmenopause, you're in the workforce, and
And I'm trying to survive. And what's happening is now I realize, okay, things are getting worse. Things are getting worse. I am having unexpected, unexplained uncharacteristic anxiety attacks, which is not me. I'm
yeah.
friendly. I'm going. I am now trying to like go to a meeting in a new role, and I'm supposed to be introduced. So it's just a simple hello, and this simple hello, I get heart palpitations. I start just anxiety. I start shaking. I
Mm-hmm.
literally need to just say my name, introduce myself, little bio, nothing,
Yeah.
no big deal. And
Yeah.
I'm shaking with anxiety in a
Mm-hmm.
full blown panic attack over nothing, nothing. And and I think, okay, what's going on? Well,
Mm-hmm.
then,
Mm-hmm.
I to maintain my career. I'm trying to learn a new occupation and trying to get in there and learn new things.
Mm-hmm.
And what I noticed is they say, oh, you're going to have a little brain fog. I'm like, brain fog. Okay. Okay.
But
Brain
what did that
fog.
really mean?
Oh, no, no, no. Brain fog and perimenopause means I can't remember where I left my keys. You do
Uh-huh.
stupid things like that, and you can't remember
Uh-huh.
where you left your coffee pot, which is in the microwave every single day. Let me tell you what, that's where your coffee's at. Now, in postmenopausal, brain fog means you can't remember your own name. When you have brain fog postmenopausal, your brain fog's so severe, you will think you have Alzheimer's. You will be in the middle of typing an email and can't remember what key you were on. You won't be able to like that. Just trying to remember one word after another in a sentence becomes impossible. And the thing is, you can't plan for it. You can't be like, okay, listen, I've got an 11 o'clock meeting. I can lose my mind at 11:30, 11:32, be just
Yeah.
fine.
Yeah.
You know,
Yeah.
you're okay with that. And no, you can't. And the thing about when these things are hitting you and you're trying to deal with it, I have to understand in my age range and in my career, I'm competing with 20 to 25-year-old men.
Yeah.
I'm trying to keep
Right.
up with young people that are at the height of their career and they're coming in hungry
Right. Right.
for
The young
for a
and
career.
hungry.
They're young and hungry. Try keeping up with those. And when you can't even remember who you are, you're like, oh, but my
Yeah.
name is, I don't know. I don't know who
Yeah.
I am. So you have those things. And that's where,
Did that just really shock you?
yes, it
Mm-hmm.
did. Nobody prepared me for that.
Mm-hmm.
And the thing about it is these are career ending things, events that can
Yeah.
happen to you
Yeah.
where you can lose your career, you can
Yeah.
lose your job, you
Yeah.
can, and there are cases of people, women that have lost their jobs, and
Yeah.
when you're not prepared for that, or you're not prepared for like when you all of a sudden get that dump where your estrogen is just gone, your estrogen's just gone, and all of a sudden you're loaded with the rest of your other hormones, but you don't your testosterone, but you don't know how to handle it. You
Yeah.
don't know what to do.
Yeah. You're not the first patient that I've heard say that, in the workforce, like I've had some say, I'm not fit to work right now.
Mhm.
I've had some who've decided to quit their job. Maybe it was stress related and they knew it was time and they just were no longer willing to do what it took to handle the job. But a lot of times people still love their job and want to continue, in the workforce. And with good right. I mean, we're going to spend a large majority of our life in postmenopause, right?
Mhm.
So how do we thrive in this environment? And I know that's where you are, like, just consuming all of the information, trying to figure out how you can best thrive in menopause. So talk us through that.
That's where I went full Monty researcher. Look, I turned my geek loose
Uh-huh.
and I
Uh-huh.
said, get out there and figure out what's going on because you're
Yeah.
not you anymore. Because that was part of it too, that's when I started researching and joining other groups out on the internet, just looking and going,
Mhm.
listening to other women.
Mhm.
And you know what? It was that's kind of when I got the education I needed. And then when I started listening to other women and hearing that they were having the same problems. Like
Mhm.
I couldn't figure out why mentally the only thing I wanted to do was sit on the couch and eat potato chips. I don't do
Yeah.
that. I'm,
Yeah.
I'm, I'm like, what is wrong with me? I'm an
Yeah.
athletic person. I love to jog. I'm yoga, all that.
And you had
I
a
am
total lack of desire for the things that you used to do.
I didn't want to do it anymore. I didn't want to work out anymore. And then the
Yeah.
other thing that really pushed me to get in there was joint pain. And
Mm.
I thought I was crazy. I thought I had developed arthritis. I'm like, oh my
Yeah.
gosh, I got to go find
All
a uro.
symptoms of menopause. All
All of it.
symptoms.
And I started listening to other women and I'm like, wait, that's me. I just want to sit on the
Yeah.
couch and I hurt too much to go work out.
Mhm.
And I
Mhm.
thought, okay, now when I started putting the pieces together, I was like, okay, here's it. I got to find a
Mhm.
doctor.
Mhm.
Now there's a real story trying to find a doctor.
Okay. So walk us through your journey for finding the right physician for you.
For me, I started kind of doing research on the internet.
Mhm.
And then I started I'd go and look at the doctor's website or I'd try to find some kind of information on maybe if they had a podcast or different
Mhm.
things. And I would
Mhm.
listen or I'd look on their website and I'd hear, they kept saying, oh, just the lowest amount of HRT for the shortest amount of time as possible. And I'm like, wait, I got me an education. And according to what I understand is that's not what I'm looking for. I am looking for a doctor that understands the benefits and
Mhm.
believes in the benefits of
Mhm.
HRT
Mhm.
and is educated themselves enough to know how to administer and work with me to figure out what's
Yeah.
right for me.
Mhm.
And I guess that's the part where, for me, when I started looking and searching for that and reading different things, and then that's when I came across you. And I saw your website and I wasn't sure. And then I heard your podcast. And when I
Mhm.
heard your first podcast, I was like, wait, that's what I'm looking for. I am looking for a doctor that understands the damage that the WHI did, that
Mhm.
understands what truly being menopause certified means.
Mhm.
And then I went to the North American Menopause Society and that website and started searching. I found you there. I was like, okay,
Mhm.
she's certified menopause.
Yeah.
I hear what she's saying. And so that's when I booked him an appointment because it was so, and this took me years.
Yeah.
This was a transition
Yeah.
that if I had been educated in my 40s or pre
Mhm.
40s and understood what's going to happen, I don't have to suffer, what needs to be done,
Mhm.
and working with a doctor who understands and is
Yeah.
educated in menopause and the different effects it will have on me from my head to the bottom of my feet.
True story.
It does. It does. And you think, look, this is how silly I was. I thought, okay, and this is what you hear on the internet all the time. Oh, your hair's going to break off. Okay. All right. Just eat collagen. Just eat collagen. You're going to be fine. And and just, gently wash your hair and things like that. I hit post menopause and I wasn't on HRT. And one day I went to wash my hair and I had handfuls of
Mm.
hair. I was eating collagen all day long. I mean, I had the
Those-
powders, the pills,
Yeah.
didn't do any
That'll scare
good.
women. Yeah.
Oh, yeah. Yeah.
So the reason that I invited you to share your story is not to toot our own horn at Sky Women's Health or, the fact that I'm NAM certified, but you are so passionate about if I only knew, if
Mhm.
the younger generation was educated and knew what to expect, because it's similar to pregnancy when it's like, oh, get pregnant is so great, have a baby. And then you get pregnant, you're like, why didn't anybody tell me this is so hard? This is so uncomfortable. Like all of that, right? And the postpartum mamas often tell me that they're the ones who actually encouraged me to start talking about menopause and doing more in menopause education because moms and grandmas aren't talking about it, right?
Mm-mm.
And so your passion for that is really exciting. I mean, you went through years of legwork of trying to get help. So let's talk about, since starting hormone therapy, how you're feeling.
Since I started hormone therapy, I feel so much better. I mean, I feel like, okay, I feel like I was very thirsty and then I do feel like I was like in the desert dry and I was thirsty and I got a drink of water, a cold glass, crunchy ice glass of water. And I feel better like all of a sudden. And the thing about it is what I didn't notice and what they don't prepare you for is menopause. It affects your mind and the way you think. That gung-ho spirit's back. I don't have to make myself go try to work out in the best I can. And then I can't realize that I hurt so much that, well, I can't even lift a weight. I can lift my weights again now. I feel like challenging myself again about, let's lift more weights. Let's get in here. I feel like running again.
Wow.
So that passion is back, that passion to learn new things, to dive in and advance my career. And those things are there. They're back again. And I didn't realize how much I'd missed it until I got it back.
So it's more than just resolving hot flashes and night sweats.
Oh, yeah. Oh, yeah.
It sounds like you feel at home in your body again.
Yeah, I do.
Yeah.
I feel like me again. And I think that's such the assertion that's been done to women. The incorrect thing is that women need to understand that, estrogen, it affects us from the top, literally the top of your head, from the hair growing out of your head to your eyes, your heart, your the way your brain.
Right. We have estrogen receptors throughout our body. So it's more than just breast and vagina, right? Breast and uterus and vagina.
Yeah.
Yes, absolutely. It is a whole body. Menopause is a whole body experience for sure. And the mental changes, the mood changes, the increase in depression, especially if you've had a history of depression during perimenopause and menopause, is real.
Oh, it is. It is
absolutely real.
And even if you have anything like ADHD or anything, it's going to get worse. It's, that estrogen just is the difference. And the difference is too, is, having a doctor too, that's going to listen to you.
Yeah.
I mean, I know we're all busy and things and on, but when you are when you're relaying symptoms, the problem is when you're out there in the medical industry, there's just so much misinformation. Just even between doctor to doctor, and they don't look at you like, oh, okay, she's postmenopausal. Well, some of these symptoms she could be having, maybe I need to talk to a gynecologist or refer her to a gynecologist.
Yeah. So I'm glad that you brought that up. So, and this is one of my soapboxes. The WHI did a real disservice to women in general, but also to a whole generation of physicians and how we train them and educate them. It used to be, I remember in training, whenever we would be counseling patients, even in pre-op, sometimes the attending would come in and we would counsel a woman. And if they were in their 40s, like those ovaries were coming out, right? And we were doing hormone replacement therapy. However, the WHI comes out and everybody wants to come off of hormone replacement therapy. There's all these scare tactics. And unfortunately, now we have a lot of providers who are not educated in hormone therapy and how to treat patients. And we're looking at it as all these individual pieces, right? The insomnia, the poor sleep and the joint pain, as all individual issues, when actually it's all related to menopause. And we didn't even mention, vaginal dryness and discomfort and decreased desire and intercourse because God, it hurts. And who wants to have sex that hurts, right? So all of this plays into the well-being of a woman. And unfortunately, there are a lot of providers who they just don't know. They don't know what they don't know. And so you're offered an SSRI. Let's give you an antidepressant and see if that helps. Well, that might be a reasonable approach, but it's not solving the lack of estrogen in your body, right?
No.
And so if you don't have contraindications, a lot of times women are wanting more. They want to be heard, they want to be seen, and they want to know that their symptoms have value, right?
Right. And it's not something, and I think the biggest concern out there is I say, oh, just get through it. And, women, we're tougher. We're tough.
Oh, yeah.
We have so much we have to deal with.
We know how to push through.
We know how to push through. So we're we're just going to get through this. You're not going to get through it. You were changing. Reality is, I don't think nature meant for us to be here. We're not supposed to be here, and I think we're supposed to be gone. And it's not fair. But thanks to modern science, we can now enjoy our lives because from postmenopause, we're looking at 30 plus years.
Truly,
you're going to live like this. And for me, And when I was one of those diehard women that was not going to be dependent on the health industry. That was not going to happen.
Yeah.
Well, yeah, it is. We're going to be partners.
Yeah. No, I've absolutely had patients say that they felt like a failure for giving in to taking hormone therapy. And then they're like, I'm so glad I did. You're not a failure if you need help through this transition. I mean, if you're in labor, maybe you want to do it naturally, right? Maybe you want that epidural.
And you're going to change that plan the second you get in there, 20 hours of pushing. Yeah, epidural.
Yeah.
Be grateful for modern medicine. I'm grateful I live in modern times. I love indoor plumbing. So let's, it's not like I'm like, I don't want that anymore. I mean, I'm going to keep my modern, my modern amenities. And so I realize now that it's not. And the sad thing, and this is what when I talk to my friends out there, when I'm talking to other women, I'm like, hey, because there's so much misinformation. The problem you'll come into as a woman, and I saw it, is that every provider that was for HRT, that it's not certified in menopause. Oh, they're pushing their medicine, their little magical pills, and they're this, and it's like, wait,
or pellets.
Yes. They're pellets. They're pushing the pellets, and they're compounding and everything. And it's like, how do you trust them? How do you trust that person that they're pushing their medicine and what they want you to do? And it's okay. It's like you go out there, and if you are a woman and you finally say, okay, I know I need HRT or I need a medicine doctor. Well, they don't know where to start, because even within, like, if we go back to just, if they went to their PCP and said, look, I want to get HRT, the PCP, who knows who they'll send them to, or if they even will. And so a lot of women are getting taken advantage of. I went through doctor after doctor, just looking and looking and looking and trying to find a doctor that was truly menopause certified. And what I found was that, look, if they're not part of the North American Menopause Society, move on, because there are people out there that are going to label themselves a doctor, and that this is what they are, and it's not the gold standard that you could have if you went to a doctor that is certified menopause. That is and I believe, it should stay within the realm of gynecological, that's what you do. That's your little, that's your body part that you specialize in.
Yeah. There is a fabulous internal medicine physician who did a menopause fellowship, and her name is Heather Hirsch, and she just wrote a book. She has a great podcast too called Health by Heather Hirsch, and she just wrote a book called Your Menopause Type. Forgive me, Heather, if I'm speaking that wrong. Know Your Menopause Type, or something about that. And so I'm excited. That comes out June 6th. So just a little plug for her book, and the fact that she is all about midlife. But I have thought about that in terms of, if you have irregular bleeding, who's going to take care of that, right? If you're in the hands of a gynecologist who is NAM certified, it's all one stop under one roof. And so that is the nice thing.
That is, but it is wonderful to know that other specialties that are going to get into it and really get in there and certify themselves or learn about menopause and the differences, because internals, they see a gamut. They're,
they're prime for it, right?
I mean, they're going to have, that's their age range, right? And so that would be my second thing to go to an internist that knows menopause.
That's NAM certified.
That's NAM certified, because the thing is, you have to get through that whole just conglomeration of, and what I found was that every time I learned something, I didn't know enough. And it's so funny, is like when I do talk to my girlfriends about it, my sisters and everything, and I'm like, okay, and they'll say, well, just tell me what to do. Just tell me what to do. I'm like, I'm not a doctor.
Right. And it's unique to every individual. So not one of my patients is on the same hormone regimen, right? I mean, providing all of the options that are reasonable for the patient and allowing it to be a shared decision-making, I think is really important.
It is really important. And it's really important to be with a doctor that has the education for you to say, okay, well, maybe because of my lifestyle, the patch doesn't work. Well, maybe you could go with this, or maybe this will work for you better. Or we have these options on, and that you keep up on the latest and the greatest, because, options change, things change, people change. And I think, as I progress in age,
Yeah. Your hormone therapy may change. Yeah.
It may change.
Yeah. Because sometimes we kind of plateau and we see a flare and we have to make adjustments. So yeah, the best kind of hormone therapy is the one that you use. And so that's key too. But I just so appreciate you sharing your story from a consumer perspective, because we all are going to go through menopause if we live long enough, right?
Yep.
And it is a challenge. And you were looking for thriving, not just surviving through menopause. And seeing you thrive again is extremely exciting, quite frankly. It's just one of the joys of this practice is to see patients thrive and the excitement that you share. So I really appreciate you spreading the word.
Oh, yes. I am an advocate now, and I am, find your right provider, be mentors, be buddies. This is gonna be a partnership because things are gonna change, and I'm just grateful I did come across you, and I want to put you on banners everywhere, going, go to her, go to her, go to her.
Well, thank you, It is an honor. It is an honor. And I just am so excited that you were willing to share your story publicly because I think that it'll help a lot of women. So thank you so much for joining us today.
Oh, pleasure to be here. Thank you so much.
All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB-GYN with a Neuromusculoskeletal Medicine Fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.